This medication is used to temporarily treat cough, stuffy nose, body aches, and other symptoms caused by the common cold, flu, or other breathing illnesses like sinusitis or bronchitis. It contains a cough suppressant to reduce the urge to cough, decongestants to relieve stuffy nose symptoms, and acetaminophen to relieve pain and reduce fever. It is not recommended for ongoing coughs from smoking, asthma, or other long-term breathing problems, or for coughs with a lot of mucus, unless directed by a doctor. It is not safe or effective for children younger than 6 years, and some forms of this medication are not recommended for use in children younger than 12 years. Follow all dosage directions carefully and do not use this product to make a child sleepy. Avoid giving other cough and cold medication that might contain the same or similar ingredients. Always consult with a doctor or pharmacist for more details about using this product safely. Remember that this medication does not cure or shorten the length of the common cold and may cause serious side effects. When taking Theraflu Severe Cold Relief 10 mg, 20 mg, 650 mg oral powder packet antitussives, make sure to carefully follow the instructions on the product package. You can take this medication with or without food, and it can be taken with food or milk if it upsets your stomach. If you are using the liquid form, be sure to measure your prescribed dose carefully using a medication measuring device or spoon. Do not use a household spoon, as you may not get the correct dose. If your liquid form is a suspension, remember to shake the bottle well before each dose. If you are taking the chewable form, be sure to chew it thoroughly before swallowing. The dosage of this medication is based on your age, so do not increase your dose or take it more often than directed without your doctor's approval. Misusing this medication may result in serious harm. If your condition lasts for more than 1 week, gets worse, or occurs with a persistent headache, rash, or fever lasting more than 3 days, be sure to consult your doctor as these may be symptoms of a serious medical problem. Some common side effects of Theraflu Severe Cold Relief 10 mg, 20 mg, 650 mg oral powder packet antitussives include dizziness, drowsiness, headache, nausea, nervousness, or trouble sleeping. If any of these effects persist or worsen, it is important to contact your doctor or pharmacist promptly. It's important to remember that your doctor has prescribed this medication because they have judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not experience serious side effects. However, it's important to seek medical attention right away if you experience any serious side effects such as confusion, hallucinations, shaking, weakness, or problems urinating. Additionally, seek immediate medical help if you experience chest pain or a fast/irregular heartbeat. While rare, a very serious allergic reaction to this drug is possible. Seek immediate medical help if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects, so if you notice any other effects not listed above, it is important to contact your doctor or pharmacist for guidance. One important ingredient in Theraflu Severe Cold Relief is acetaminophen, which can cause serious liver disease if taken in large amounts. Adults should not take more than 4,000 mg, 4 grams, of acetaminophen a day, and those with liver problems and children should take less. It's important to consult your doctor or pharmacist to determine the safe amount of acetaminophen for you. It's crucial not to use this product with any other medication containing acetaminophen without consulting a healthcare professional first. Acetaminophen is found in many over-the-counter and prescription drugs, such as pain/fever medications and cough and cold products. Be sure to check the labels of all your medications to see if they contain acetaminophen, and ask your pharmacist if you're unsure. If you accidentally take too much acetaminophen, seek medical help immediately, even if you feel fine. Symptoms of an acetaminophen overdose may include nausea, vomiting, loss of appetite, sweating, stomach pain, extreme tiredness, yellowing of the eyes and skin, and dark urine. Regular alcohol use, especially when combined with acetaminophen, may harm your liver, so it's best to avoid alcohol while taking this medication. It's important to talk to your doctor or pharmacist before taking Theraflu Severe Cold Relief if you have any allergies or medical conditions. This medication may cause dizziness or drowsiness, so it's best to avoid driving or using machinery until you know how it affects you. It's also important to be cautious if you have diabetes, alcohol dependence, liver disease, phenylketonuria, PKU, or any other conditions that require you to limit or avoid certain substances in your diet. Before having surgery, make sure to inform your doctor about all the medications you are using. If you are pregnant or breastfeeding, it's important to discuss the risks and benefits with your doctor before using this medication. Older adults may be more sensitive to the side effects, so it's important to be aware of any changes in your body. It's important to be aware of potential drug interactions that could change how your medications work or increase your risk for serious side effects. Taking certain MAO inhibitors with Theraflu Severe Cold Relief 10 mg, 20 mg, 650 mg oral powder packet antitussives may cause a serious and possibly fatal drug interaction. This includes medications such as isocarboxazid, metaxalone, methylene blue, and moclobamide, among others. It's crucial to consult your doctor before starting or stopping any medications, and to be cautious of products that may interact with Theraflu, such as ketoconazole and rolapitant. Additionally, it's important to check the labels on all your medications carefully, as the ingredients in Theraflu may be present in other prescription and non-prescription products. You should also inform your doctor or pharmacist if you are taking other products that cause drowsiness, and be cautious of other medicines that may contain ingredients that cause drowsiness. It's also important to note that this medication may interfere with certain urine lab tests, so it's essential to inform lab personnel and your doctors that you are using this drug. If you suspect an overdose and notice serious symptoms like passing out or difficulty breathing, call 911 immediately. Otherwise, contact a poison control center right away. In the U.S., you can call the local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control center. Symptoms of overdose may include nausea, vomiting, loss of appetite, sweating, stomach/abdominal pain, extreme tiredness, yellowing eyes/skin, dark urine, agitation, confusion, hallucinations, and seizures. It's crucial to seek medical help if you suspect an overdose. Make sure to keep all of your scheduled medical appointments and any necessary lab tests while taking Theraflu Severe Cold Relief. This will help your healthcare provider monitor your progress and make any necessary adjustments to your treatment plan. If your doctor has instructed you to take this medication regularly and you accidentally miss a dose, take it as soon as you remember. However, if it's close to the time of your next dose, it's best to just skip the missed dose and take your next one at the usual time. Avoid doubling the dose to make up for the missed one. Make sure to store the Theraflu Severe Cold Relief 10 mg, 20 mg, 650 mg oral powder packet antitussives as directed on the package label, and protect it from light and moisture. It's important not to store it in the bathroom. If you have any questions about storage, be sure to ask your pharmacist. Also, keep all medications away from children and pets. When it comes to discarding the product, do not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard the product when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.